There are 19,728 confirmed aggregate cases of coronavirus throughout Victoria since the beginning of the pandemic. That's 51 new cases since yesterday's update. I'm sad to say there have now been 701 Victorians who've passed away as a result of this global pandemic. That's an increase of 7 since yesterday's report. 4 males in their 70s, 2 females in their 80s, 1 male in their 80s. 4 of those 7 deaths are linked to outbreaks in aged care. Of course, we send our best wishes and our sincere condolences, our sympathies to each of those 7 families. There are 169 Victorians in hospital. 17 of those are receiving intensive care and 11 of those 17 are on a ventilator. There have been a total now of 2,443,583 tests that have been received. That is 14,805 additional results received since yesterday. On that point, those numbers obviously are higher than we had earlier in the week, but still we'd always like to see those numbers up as high as possible. So everybody who's got symptoms, even the mildest symptoms, and as soon as those symptoms begin, please come forward and get tested. There's now more than 200 test sites across the state. We will come to you if you're unable to go to a testing site. It's just so important. Logic tells you, and the strategy is best when we have the clearest picture of how much virus is out there, and that's dependent upon people going and getting tested. So again, we urge all Victorians who've got even the mildest of symptoms, come forward, get tested, isolate at home until you get your result. 90+% of those results are now back within 24 hours, and that means that we can have the clearest picture of how much virus is out there, where it is, patterns and chains of transmission. It makes our response collectively much more effective, and it will get us to the other side and into that COVID normal much sooner. There are 4,306 cases with unknown source. That's 31 since yesterday's report, so they'll be closed out from investigations, not just from yesterday, but from multiple days before that. There are 251 healthcare workers who are active cases. We send our best wishes to them, of course, and we thank them and all of their colleagues for the amazing job they're doing right across the state. They are true heroes, and we are all indebted to them. There are 1,483 active cases in Victoria, so the number of active cases continues to fall. That is very pleasing news. In terms of the regional metro split, there are 72 active cases in regional local government areas under stage 3, so regional Victoria. That is, again, very pleasing to see those numbers from a very high base. They've stabilised, they've steadily fallen, and now we're very pleased to be able to report that there were no new cases in regional Victoria overnight. Colac has 29 active cases, Greater Geelong has 11 active cases, Greater Bendigo just 2 active cases, and Ballarat no active cases. So communities that were of some concern to us a few weeks ago, those communities have done a mighty job in following the rules, getting tested. Indeed, all regional Victorians have, from the smallest of country towns to some of these bigger regional cities. These numbers are low, and that is in large part due to the amazing efforts that regional Victorians have made. The rolling averages from the 27th of August to the 9th of September, Metro Melbourne is 70.1, regional Victoria 4.5. What that shows us is that regional Victoria are quite close to being able to take perhaps not just 1 step but 2. We have to be heavily caveated in terms of that. We need to make sure that we continue that trend going forward, but we're confident that those numbers are low and getting lower, and that means that there'll be an opportunity quite soon for us to take some significant step or steps towards that COVID normal for regional Victoria. We'll then have to defend that in terms of testing numbers remaining high, people following the rules, COVID-safe work plans, particularly when it comes to workplaces large and small. Jill has joined us today and will speak in just a moment to those efforts, both in metropolitan Melbourne and in regional Victoria. WorkSafe are working incredibly hard. And industry, I think, is really stepping up. Even those really high-risk industries, people are doing an amazing job in being as safe as they can be. And that's why a feature of these last few weeks, these last few months even, has not so much been big outbreaks in high-risk centres. There have been some, but it's a very different place. And that sense of continuous improvement, industry by industry, workplace by workplace, has made a massive difference. Just before I make a couple of general comments, can I also give you the aged care outbreak? There are now the total number of cases associated with aged care. There's 763 active cases. Those numbers continue to fall. We are pleased about that. That sense of stability has come to aged care from a position of real crisis. In terms of aged care shifts that have been worked by hospital staff, 4,229 shifts have been filled in aged care facilities. That is a massive effort, and again we say thank you to each and every one of those hospital staff who have done an amazing job in bringing stability to that sector. In disability facility settings, there are 16 active cases, 10 staff and 6 residents. So again, vulnerability is a key in those settings, and those numbers are stable and indeed falling.